Thank you for joining the Doctor Whisperer. I am your host, Sharon Feckety, and I am happy to bring you a show where we talk about the business of medicine. I hope that you enjoy it. Please feel free to share, subscribe, and pass it on. Enjoy the show. Hi, everybody. Well, as you heard who I am in the introduction, it doesn't really matter about anything else now except my introduction to Cody Hall, who is the founder and CEO of Octiva Healthcare. All the way from Viva Las Vegas. No, he's not at the casino, but I'm quite sure that he is as hot as we are here in Tampa Bay. So welcome to the show.
Thank you for having me.
Thanks, Cody. So listen, I'm really intrigued. Of course, this podcast is all about the business of medicine. So why don't you share with the audience what Octiva Healthcare is?
Yeah, well, good thing we're in the same business, medicine. And so we do a lot of things. Our primary focus and thesis is to bridge some of the access and social barriers that prevent patients from achieving success in healthcare by leveraging behavioral, medical, and social levers powered by technology. Mission statement kind of chopped up. But what we do, right, is we partner with our biggest partners are hospitals and primary care practices. On the hospital side, what we do is we attach ourselves to the facility and we support all patients. Now that's all with an A and two L's, all patients as they go back to the community versus just Medicare patients or this group's patient or this group's patients. We give everyone the ability to access 24-hour triage, nurse support, and access to community resources that we have established to support that community. Going a step further, we support the primary care with their after hours, which is after 5, before 8, what I refer to as the other 20 hours in the week, so that they can rest and kind of hang up their hat and not have that physician burnout that's so prevalent nowadays, as well as we work to drive patients appropriately back to their primary care practices. So we make them 24 hours a day, not having to worry about patient leakage, but also ensuring that all their patients are cared for and they're not overworked. So that's kind of what we do.
So talk to me like I'm 4 years old.
Okay.
I am a 4-year-old patient, and my parents have just let me out of the hospital finally, and they are so excited that Octiva Healthcare is there for them. But what does that mean? What does that look like?
Yeah, great question. So it would start off with an introduction bedside. So one of our transitional care assistants would come bedside, explain to them that they're suitable for the program, why they were flagged as suitable for the program, whether they requested or if there's something along the nurse or the case manager's interview. And then we tell them what the benefit is for them, being that, hey, you are in a high acuity bracket, or, you know, you're a part of like a Medicaid program. So we have access to your resources. We can help navigate. And then, of course, for those who kind of have it all already, we're just an extra layer. And so that's kind of what it would look like for patients. We don't see a lot of pediatrics. We do a lot of adult, a lot of geriatrics. However, that would be the experience for the patient in the bed. Then they would receive a call after discharge. We help them avoid things like spam numbers by identifying our cell phone and number that's going to be reaching out to them. We have about an 85% success rate for post-acute engagement compared to other organizations that float in around the 45. So we are very successful engaging the patients that enroll in the program. And then we create a care pathway with our nurse and our provider team, depending on their level of acuity. And that care pathway takes them out to their 30-day mark or until they go to a primary care, because some of our markets do have longer 45 to sometimes 2-month waits to see a primary care visit if it's with like a federally qualified clinic.
Okay, again, only because I know that my audience is, you know, there's a variety of people that listen and watch this show.
Of course.
What do you do? Meaning,
okay, so I think the easiest way to say it is we are a 30-day
before you tell me that, who qualifies? What does that patient look like? What are the parameters that a patient would go, oh, you know what I would really benefit from? Octiva Healthcare.
Yeah, well, we try, and so I'll answer 2 questions.
Okay.
What do we do? and just think of us as a 30-day limited warranty post-discharge. And so
Okay.
we're there for whatever comes up, fill in the blank. I don't think there's many things we haven't encountered.
Okay.
From
Maybe some
medications.
examples. Yeah. What are some examples?
Medications being too costly,
Okay.
medications being sent to the wrong pharmacy. They go to the pharmacy that they selected, but it's actually been sent somewhere else. And so where do they go? Do they go back to the emergency department and get readmitted so that they can get the pharmacy sent to the right location? So some complexities that they have to navigate. We bring this expertise to help them navigate the behavioral challenges, the medical challenges, and the social challenges being food, transportation. I don't have a primary care physician, or I don't know how to attain a specialist. So we help them navigate their own individual systems, which we do well. And sometimes people don't understand healthcare because it is very complicated.
Sure.
On the other side of that, who's suitable? What do they look like? Well, that's the whole part of the all aspect. You know, our whole purpose of the program is to make sure that we are driving equality in healthcare and equity in healthcare. So what we refer to is not so much of an eligibility criteria, but more of a suitability criteria. And it's broken down as a patient who has the basic means and desires to participate in the program. Now, the basic desire is them wanting, they have to be compliant. Patient gets to choose, and the basic means is a telephone. So if they have those two items and they want to partner with Octiva, and Octiva's partner with their hospital, then they'll have the option for that program.
So when I think about primary care doctors, of course, the word burnout comes to mind. Being overwhelmed. Primary care doctors never hire me as the doctor whisperer for marketing needs or really anything, because they're already overwhelmed, and they're the only types of practices that I know that put a sign up that says no new patients accepted, right? Which to me, you know, it's like, wow, there's an issue there for growth if no new patients are being accepted. So at 5 p.m., you know, I think, oh, the answering service, the doctor's on call, you know, so what services does Octiva provide specifically to the primary care docs? We interrupt this awesome podcast to share with you about our sponsor, TIE Technology. TIE Technology was founded with the thought that every customer deserves exceptional customer services. So if you know of any company that has a phone system where the auto attendant doesn't really sound good, you press 1 and you think you're going to go to a live person, but you end up with a broken recording, it's probably time that you call TIE Technology. And if you mention this podcast, you will get the first 3 months for free. So make sure you mention the Dr. Whisperer podcast show. Check them out.
Yeah. And so we refer to it as powering their after hours. The after hours, the patients, the clinic, that is all belongs to the provider, whether it's a nurse practitioner, depending on what state you're in, or the actual physician. So in those circumstances, we pick up all the administrative calls that happen after 5 p.m. during their lunch break. And so we have a multi-level support element. So administrative, nurse, and provider. And they all have their individual purposes. One is to ensure that patients calling for questions, maybe about their records, if we're connected to the EMR, depending on how big the group is, or if they have a general question about the practice. We also have the nurses for ones who have questions about usage of medication and other items that pertain to their most recent visits or to a future visit. Maybe they're having concern. They need to be triaged and placed in the right bucket. Do I go to an urgent care right now? Do I go to the emergency department, or do I wait next week until I can get an appointment? And then you have our providers, which their main focus, hopefully we see as few patients from the practice as possible after hours on the weekends, but their main purpose is to make sure we don't send the patients out into the ether, as I refer to it. We're trying to create a strong center of gravity for the primary care, so that the patients can get everything they need at the primary care level. So if it's an item we can take care of while not sending them to an urgent care, that's something that we'll do, because you send a patient off to an urgent care, they may never come back to that physician. They may get hooked on fast medicine and see, oh, I can go to urgent care whenever I want. or they'll just go to their, what we call their favorite ED doctor, right? And so what we do is really try to focus and concentrate the efforts around the primary care to keep the patients with them, and of course with the physician that they know and work with.
So does that mean that you are providing telehealth services through hired clinical representatives? Is that what you're alluding to?
Think of us as a bolt-on telehealth attachment to a primary care. We make a primary care practice, whether it's one who does virtual visits during the daytime, we make them 24/7. And so now a primary care practice can give all the same great benefits that a larger group or a telehealth organization can do, while also operating their everyday practice hours at their locations.
So is that specifically what it means? So 12 o'clock, and the worst thing in the world, right, is you call your primary care at lunchtime.
Yes.
because all of the humans normally are going to work Monday through Friday, and they get this one little window of 12 to 1 p.m. or 1 to 2. And it turns out that every doctor's office is closed during that time, and it goes to an answering service. So what you are saying is that they call the primary care office at noon during the lunch break, and you get a live person?
Yes, there is no more lunch breaks. We do have humans who work for us.
Good. That's what I want. I want to know.
We are humans, but our organization covers those hours, and our company staff during those unconventional time periods that otherwise are right after a physician closes practice, right before they open, or during that, what's about 2-hour period during the daytime that different practices have their lunch. And since we support practices across all the time zones, we have about a 4 to 5 hour period where we have, the different practices taking lunches, where our call volume spikes.
Mm-hmm. Yeah. And so even at night, there's no primary care doctor that I don't know that's in practice by himself that doesn't take call after 5 p.m. He doesn't really have much of a life socially. So from the hours of 5 to 8 p.m., he's getting phone calls. So now these calls will be routed to Octiva Healthcare, and it would be seamless, meaning that the patients wouldn't know.
Yeah, we refer to ourselves as the shadow. And so we actually don't want to be in the spotlight. We have something called voice whispering on our system that actually says, oh, so-and-so practice is calling. And so we answer, like, thank you for calling after hours at practice. And so rarely do we identify ourselves, only at the time where they'll speak to a provider, where they'll be informed that, hey, we're speaking to an Octiva provider. Other than that, it's as if they're calling an organization that is within their own practice. And the purpose is for us to catch those things that maybe the patient calls in at 6 o'clock because they need to ask a question. And instead of waiting till Monday, which is potentially plausible, 86% of all our patients go back to their primary care for a follow-up after our encounters. Maybe they'll go to urgent care. And that now what we've done is we divided that patient's healthcare information into 2 different locations. That patient could have waited till Monday to an available appointment and seen a physician that is their primary care. And so what we do is we really kind of funnel the patients into their appropriate dispositions so that they can see the physician that we desire them to see, depending on if it's urgent, not urgent, or if it's something more timely. Now the patient always has choice, and patients can do whatever they please. However, we give them our guidance based on their acuity.
I love it. So why wouldn't people hire Octiva?
So we have all types of it. So we are fairly niche in regards to the fact that there's not a ton of folks doing exactly what we do. Now, there are folks who do what I call quasi competitors. You can hire a nurse triage team or someone to answer your phone calls as admin, but we are intimate in our relationship. We have daily reports that are pushed out from our system, monthly quality and volume reports. Everyone has a dedicated account manager. It's admin, it's nurse, and it's provider. So, but we also have an organization that operates in multiple aspects of healthcare. So we can provide that infrastructure at a lower cost to the primary care practices without gouging them. Because primary care practices, we understand that if you're a single provider or physician group, a dollar that you do not put in your pocket, you pay someone else, is something you're not receiving. So we understand that. And what we do, and the reason we do it is because we want the primary care to succeed. People who do not do it, we've heard it all. Honestly, we have a sales team that sells across the United States, and we find that oftentimes either, and I'm quoting, I'm not saying who I'm quoting, but I'm quoting, they don't care what happens after hours. I see my patients, and if they need help, they'll call 911. We've heard it all. Now, we've also heard that, hey, listen, I like being on call for my patients. I want to answer that phone call. But those are the biggest things. And very rarely is it cost. We try to be as economically friendly as possible in our offering. But most of the time, it's what they want or it's what they don't want.
So how long has Octiva Health been around for now?
We've been around for 2 years, since we were born in the pandemic.
Another baby born in the pandemic. Oh my
Yes.
goodness. It is so needed for sure.
Yes.
And do you find that you partner more with hospitals versus primary care practices? I just, knowing what a great service it would be for primary care. I ran pediatrics for 8 years, but I worked in adult medicine for many years. The specialists don't typically need too many after hours, but the primary care doctors certainly losing their, there's a great group that's right near me locally that for sure, if the patients knew what a glorious experience they would have at one of these, emergency care facilities that are local here in Tampa Bay, there's a good chance that they won't go back. So I like the idea of keeping them in-house. It's one of the reasons that I myself opened an after hours practice on top of the practice that we were running, because you need to keep your patients happy. And a lot of that has to do with being available during the times that the humans get sick.
Yes. Healthcare is 24 hours, 7 days a week, 365.
That is correct. Well, Cody, I love this business. I think that this is phenomenal. And I'm so glad that we got to learn more about your offering today. And I hope that, I'm going to tell people about it. I think it's great.
Please do. Our largest portion right now is hospitals. They're our biggest partners, but after hours is gaining. Over the past couple of months, its revenue is multiplying, which is great. I think it will, just because of the shorter sales cycle and things of the ability of the individual primary care to make that decision versus the bureaucratic situations that exist at large facilities. We're able to get more partners quicker, and we're able to leverage all of our providers, our nurses, and our very large national and world-based team to support all of our partners. So I think one day after hours care will overtake hospitals.
Oh, I believe you. I believe you. Well, thank you, Cody. Thank you so much for joining.
No, thank you for having me.
So don't forget, if you mention that you've seen the show or listened to it on the podcast, mention Thai Technology and you will get 3 months for free.